Good morning and welcome to the Health and Social Services Committee meeting for April 6th. I'm going to do call the roll. My goodness. So when you're ready, press yes if you're here.
Point of order, I can't hear what's going on.
I know there's a lot of chatter happening.
They're on order.
Councillor Brenner, can you just hit yes?
Perfect, and thank you. Is there any declarations of interest with the agenda today from any members? Seeing none and hearing none, I'm going to move over to the adoption of the minutes. This is March 9th, Health and Social Services Committee. Can I have a mover? Mayor Carter, and Councillor Brenner. Any questions? All in favor? And moved. We have no statutory meetings. And prior to moving to the presentations, I'm going to call on Commissioner Stella. I'm not saying it. We're just going to do just an introduction to a new staff member who has joined us.
Good morning and thank you, Chair Roy. I just wanted to announce our new Director of Children's Services who's joined us today. You've met Julie Gaskin before. She was our manager of the Early Learning Program and has been the key lead for the Canada-wide Early Learning and Childcare Program. And she started in her new role this past Monday. Lisa McIntosh, who you know was the Director of Children's Services for the past many years, 16 years in the program. She is continuing to assume her role as Director of Income, Employment, and Homelessness. So I'd like to congratulate both directors. Welcome.
Now we're going to move on to presentations, and Busola and Marianne, the tools to inform introducing data trackers for population cancer, maternal and infant health. Welcome and thank you.
Chair Roy, committee members and guests. My name is Marianne Petrusiak and I am the Manager of Health Analytics and Research at the Health Department. Prior to COVID, my team was working on moving some of our large health status reports from PDFs into interactive dashboards. We did not have the chance to complete them before COVID monopolized our time, but we did get a lot of firsthand experience with the COVID-19 data tracker. Since then, we have used that experience to develop new dashboards that present various health data. I'm very pleased to introduce a member of my team, epidemiologist Busola Ayodele. And Busola is going to showcase 3 of our new data trackers on population, cancer, and maternal and infant health.
Good morning and thank you for the opportunity to present today. As Marianne mentioned, I am an epidemiologist with the Health Analytics and Research team, and I will be introducing you to the data trackers for population, cancer, and maternal and infant health. So the 3 trackers I'll present today each have their own direct links on the Durham Region website, and this slide is just showing you what those links are. So the population data tracker can be accessed at durham.ca/population, the cancer data tracker at durham.ca/cancerstats, and the maternal and infant health data tracker at durham.ca/birthstats. First, we'll start with the population data tracker. The population data tracker provides population counts for Durham Region and its 8 municipalities, and the data source for this tracker is Statistics Canada's Population Estimates by Public Health Unit. The population data tracker has 4 tabs, as you can see in the top right corner. The snapshot tab is a summary tab that shows information that's available elsewhere. So on that tab, you can look at the summary of population estimates by age and sex. You can look at the percentage of children and youth aged 19 and under. you can look at the percentage of seniors age 65 and older, as well as population growth. The second tab, which is the trends tab, looks at population change over time since 1986, and you can view this by age, sex, and by Durham Region municipality. The third tab is a population pyramid, and that just shows a distribution of the population by age group and sex, and a picture of that is on the bottom right. And lastly, we have the percentage change tab, which looks at the change in the Durham Region populations between 2011 and 2021. On the next couple of slides, I'll go over some highlights from the population data tracker. So the estimated population of Durham Region in 2021 was just over 727,000 residents. And the largest municipality is Oshawa, with an estimated population of just over 180,000 in 2021. Between 2011 and 2021, the overall population increased by about 16%. The population of children and youth increased by 24%. The population of seniors increased by 16%. And the largest population growth was seen in Clarington, with an increase of about 20% between 2011 and 2021. The next tracker we'll discuss is the Cancer Data Tracker. The Cancer Data Tracker provides information about diagnosed cases of cancer as well as deaths from cancer, and it provides this information by sex, age group, cancer site, for example, lung, as well as year. It also compares Durham Region to Ontario, so users can look at how cancer rates in Durham Region compared to the rates in Ontario. The source for the Cancer Data Tracker is the Ontario Cancer Registry. Some highlights from the Cancer Data Tracker. The most common cancers in Durham Region between 2010 and 2018 were lung cancer, breast cancer, prostate cancer, and colorectal cancer. Between the same period, 2010 and 2018, we also saw a significant decrease in lung, prostate, colorectal, bladder, and ovarian cancer diagnoses. And we saw a significant decrease in lung and colorectal cancer deaths. Lastly, we'll talk about the Maternal and Infant Health Data Tracker. This tracker provides key maternal and infant health indicators for Durham Region and its 8 municipalities, and users can view these trends by year and over time. The data sources for this tracker are hospital data, as well as birth registries that are made available to public health units. The Maternal and Infant Health Data Tracker presents 37 indicators under 4 categories. The first category is pregnancy and birth, and this section looks at birth rates, teen pregnancy rates, home births, and births by hospital. The maternal health section looks at the health of parents before, during, and after pregnancy, and some of the indicators we report on are alcohol and drug use during pregnancy, smoking, maternal mental health, maternal weight gain, and gestational diabetes. The birth outcome section looks at indicators like low birth weight, preterm birth rate, stillbirths, and congenital anomalies, which are also known as birth defects. And lastly, the breastfeeding section looks at indicators like intention to breastfeed and breastfeeding initiation. Some highlights from the Maternal and Infant Health Data Tracker. There were 7,591 newborns born to Durham Region residents in 2021, and only about 1% of these births were home births. 22% of those who gave birth in 2021 reported at least one maternal mental health concern during pregnancy, and this was a significant increase from 15% in 2013. The gestational diabetes rate increased significantly from 5% in 2013 to 11% in 2021. And lastly, the teen pregnancy rate decreased from about 20.8 per 1,000 females in 2013 to 3.4 in 2021. And what that last one just means was that in 2013, we saw about 21 teenage pregnancies for every 1,000 female teenagers, and that number dropped to about 3 in 2021. The maternal and infant health tracker is accompanied by two complementary documents. The first one is a technical notes document that serves as a user guide, but also has more detailed information about how each indicator was calculated. And for transparency, we've also released an open data file that allows users to download the data, the community level data that we use to populate the tracker. We currently don't have an open data file for the cancer and population data trackers, but we're working on those and should be releasing them soon. When are the data trackers updated? So the population data tracker and the maternal and infant health data tracker, they're both updated annually, and we expect the next update to be this summer when we will add 2022 data. The cancer data tracker is updated when new data are available, and the next update will possibly be in 2024. We welcome feedback on our data tool, so we have released a data tool feedback survey that can be accessed on all three data trackers that I talked about today, as well as on some of our other health department data tools. And the survey allows users to provide feedback, ask a question, or report an issue with any of our data tools. And that brings us to the end of the presentation. Thank you, and Marianne and I will be happy to answer any questions.
Great, thank you very much. This is very informative. Mayor Carter.
Good morning, Madam Chair. Thank you very much. Good morning. So, easy question. Why is this information so important?
It's important because it lets the public access the data that they need to improve their health. We sometimes get requests on information on health data, and by making it available in the format that I presented, it's easily accessible. They don't have to read long reports, and it's available for them. And with the open data file as well, it gives them easy access to the community level data as well as information on how we calculated it.
Okay. How is the information going to be utilized by the region of Durham in regards to social services or health departments?
So this information is very useful to our staff, and it is used regularly for the planning. So, for example, to understand where some of our priorities are, say maternal mental health is one, it's easily understandable that where some of the issues are, maybe particular age groups. There's a lot of information that you can drill down to that is very helpful for understanding our programs and where our priorities should be.
So how does that fit into when you're looking at cancers? And that is a direct, I presume, role of the traditional hospitals and cancer centers. So how is this information helpful in regards to our health department or our social services department?
So part of Ontario Public Health Standards is that public health units must provide this information to staff, to the public. So that's one thing. The other thing is that the hospitals can look to this information. So not only is staff and the public have this information, but a lot of our community partners, and that's key. So it could be things like school boards who are looking at our birth numbers. It could be hospitals or Ontario Health that's looking at our cancer rates, understanding where higher rates of cancers are can also be helpful for understanding where our screening program should be. There's a whole layer of information, and the health department works with a variety of these community partners for this.
Okay, great. The information that you're gathering is it just numbers based, or is there a kind of a deeper dive to find out why? And I'll give you an example here. You've got teen pregnancy rate decreased by 20.8 per 1,000 females in 2023 to 3.4% in 2021. Is it just a number, or do you actually say, okay, so what happened here? Why is this trend making such a significant impact? Or what are we doing right, or what's going on?
So in terms of the dashboards at this point, they're just the numbers. There are some summaries that exactly highlight some of those particular pieces. What we are in the process of developing now are some infographics that will highlight some of those pieces of information and provide a little bit more context around those numbers. Teen pregnancy in particular, one of the issues in terms of the numbers going down, and we've seen this everywhere. This is not just Durham Region, it's Ontario, Canada, a lot of places. There's a variety of reasons why those rates might be going down. One piece is that we do not have access at this point to data on medical pregnancies, and that would be a big piece of why some of that information, that trend is happening.
So would that be a complication in regards to then taking this information and making sure that the data that we have really reflects the investments we're making in those appropriate departments? I mean, I would think that would add to a complication. Am I correct?
So we work with the program staff
Right.
to understand why some of this information, why some of the trends are the way they are. So they would have a good background of understanding the data. In terms of there's always some kinds of limitations to the data that we're looking at, and so whether it's, for example, cancer data, we can only look at it for Durham Region. We don't have access to lower level data at a municipality level, for example.
But wouldn't that be helpful?
Oh, absolutely.
Yeah,
But we
okay.
don't get that from
Okay.
Cancer Care Ontario.
Okay.
And some of the data that we have as public health unit, other agencies like the hospitals, for example, would not necessarily have. So there's a lot of different layers to how this information is used.
Okay. The number on cancers that have decreased, is there any kind of reflection in regards to why those numbers are going down?
Probably the biggest reason for lung cancer going down is smoking rates going down.
Right.
That is number one. And smoking is also linked to a number of other cancers. So that would likely be the most important reason.
And just out of curiosity, the population estimates, where did that information come from?
The population estimates come from Statistics Canada, but then they provide those to the provincial government. We pull that from a large database called IntelliHealth, and that's how we get that information. We have it down to single year of age as well. So we group it into 5-year age groups, but that single year of age allows us much more flexibility in case somebody requests, for example, I'd need to know the number of children that are aged 1 to 4. So we can do that, but that might not be available to everyone.
My last question is just not bragging, but the City of Usher is 188, by the way. Just thought I'd let you know that because we got the latest data on it. So thank you very much. I greatly appreciate the presentation and the information. Thank you. Thank you, Madam Chair.
Thank you. Mayor Foster.
Thank you, Madam Chair. Marianne, thank you. The bit about the infographics. Humans like to connect dots that don't exist, and we tell ourselves stories. So some background information for the public is important. I'll chew on a very familiar bone. Do you look at trends in this data and compare that against where applicable trends in terms of what we are doing? So we just spent a couple of $2 billion last week, 2 weeks ago, I guess, on the budget. But resourcing should be tied to trends going up or down. Do we do that?
We definitely look at trends in terms of whether some of our investments in particular areas are related to trends. It may not be that direct. It obviously, any of the money that we're trying to put into areas that we've identified as priorities, that's one of the ways that those decisions are made. We do a lot of evaluations as well in my area, and that kind of can get at more specific information in terms of whether a particular program, for example, is successful or not. I can't remember what else I was going to say, but
Well, that's all right. Yeah. So, and we've really, Mayor Carter and I have taken this and we're pushing in a different direction. Thank you, Madam Chair.
I remember what I was just going to say is that a lot of these issues are extremely complex. So it's not that easy to just put money into something like mental health, for example. There's so many different ways that, or homelessness, any of those really, really complex issues, they're not easily solved. So putting money is one thing, but it's also a matter of working together across a lot of different sectors to solve those problems.
If it was easy, it wouldn't be any fun.
Absolutely.
But I guess if we look at the change in demographics, the increase in the rate of seniors versus, I'm going to say children, youth, the concern there, are we recognizing? So we are a political body. We will quite possibly overemphasize or not the need of seniors, assuming we could ever, and maybe ignore that other part. So I'm glad to hear you're making those decisions. When you see significant changes in trends or variances between what's happening in Durham and the province, what steps would you normally take, and how would you highlight them for us?
So as epidemiologists, we really like to look at trends from a variety of different ways, and it really depends upon the specific data to understand what's going on. Sometimes a trend, we could be higher in Durham Region because of our demographics, for example. You just pointed that out in terms, so traditionally, Durham Region has had a much younger population than Ontario. I don't know if that's quite the same as it was before. Our birth rate has dropped a fair bit, but we do have an influx of young families where we're having new subdivisions, and you would have been experiencing this in Clarington in particular, right? So those kinds of demographics are going to have a huge effect on some of our health indicators. That's one of the pieces of information that we're going to look at, is understanding some of our demographics and how that might be driving a particular trend. We are also working on updating our health neighborhoods data. So the 2021 census data, we're just waiting for it in the next month or so. And we're going to be updating a lot of that data. That's going to also help to understand some of the very specific information that's coming down to a neighborhood level.
Thank you, Madam Chair. Thank you.
Thank you very much. Councillor Anderson.
Thank you.
Oops. Just hold on. Your microphone's not on. There you go.
Okay. Just a quick follow-up to Mayor Carter's questions around cancer. So if there is a specific area that there is an increase in cancer, comparatively speaking to other areas, would you do research to find out the cause of that? I know you alluded to that you would provide supports, whether it's...
We do definitely look at cancer rates and how they are different from from Ontario. We don't have below Durham Region level. Really, it's understanding the literature around those cancers, another complex issue. One of the other things that can influence cancer rates is how those cancers are diagnosed. So there are certain cancers, and thyroid cancer is a prime example, is that those cancers can be fairly common. They fortunately are not deadly often, but they can be commonly diagnosed. And so where there are physicians who are more likely to be looking for those cancers. They're more likely to find them. So GTA, for example, the Greater Toronto Area tends to have higher rates of certain cancers because they have more physicians who are diagnosing those cancers. So that's also another factor. Also, technology can play a big role. So if there is a new diagnostic test that is more likely to pick up a cancer, that can have a big effect on the trend. So all of a sudden you can see a big increase in a particular cancer. It may not be related to the fact that there are more of those cancers. It's just that we're picking up on them, we're diagnosing them.
Okay, thank you. Because my question was around environmental concerns, like
Those environmental concerns with cancers is much more difficult to pick up. And part of that is that cancers have a very long latency for the most part. It does depend a lot on the type of cancer. A leukemia is very different than a lung cancer, than colorectal cancer. So they're all epidemiologically distinct. Each one has different risk factors. Environmental factors, now smoking is a big environmental factor, so that's one thing. But what people tend to think of is maybe pollution, much more difficult to kind of pick up with specific cancers in a particular area. They partly because you have to have been exposed to those cancer-causing agents for maybe 20 years, depending upon the type of cancer. Again, much more complicated to pick up. We're not likely in Durham Region to pick up on those types of things, except through looking at what research has been done internationally, nationally, to understand the specific epidemiology of those cancers.
okay, thank you.
Any further questions? I actually do, and it does with relation to your numbers and what you were just actually speaking to with the cancer rates. One of the components is the education, such as cessation of smoking, which I know that the region of Durham was a big proponent on for the longest time as well too. And that education out there to the community, I think, had a big factor in helping to see the reduction. So with the diagnosis in the 4 areas in particular that you have given identification as to what is predominantly within the region of Durham, you also alluded to the other where it comes down to the diagnosis, the diagnostic component of it. So if I'm diagnosed with leukemia, but I live in Whitby, would those numbers reflect here, but I was diagnosed downtown Toronto? Is this address-based or is it?
It is address-based. Pretty much all of our data is address-based. And as a public health unit, we have access to data across Ontario. So the way that we would analyze it is by Durham Region residents. You take some Ontario Health or a hospital, they're going to be analyzing it by who's coming to their hospital, regardless of where they live. So those are some of the differences of how you can take the same data but look at it different ways.
And just for a fact for all of us around the table, the 4 cancers that are identified are predominantly the cancers that are treated at Durham Regional Cancer Centre. If you're diagnosed with anything outside of this, you actually go to another facility, which is usually in the GTA, just because of the expertise. And that's how they started out with the cancer centre as well. So, seeing no other questions, thank you very much for the presentation. And now I'm going to move on to Roberta Jago, Program Manager, Housing Services Division, Community Housing, the new legislative framework. Good morning.
Hopefully you can hear me. Okay. And I have a presentation that should be coming up shortly. There we go. So I'm here today to talk to you about the new legislative framework for community housing under the Housing Services Act, as well as how that framework can support the sustainability of community housing in the region of Durham. Perfect, it works. At Home in Durham is the Region of Durham's 10-year plan that sets out the region's long-term vision for housing. It's supported by the Master Housing Strategy. Its implementation is supported by the Master Housing Strategy. And both At Home in Durham and the Master Housing Strategy commit to the long-term sustainability of community housing and the preservation and growth of housing assistance for low and income renters in Durham. Community housing provides is essential in meeting the affordable housing needs of our communities. It represents almost a third of the total rental housing stock and almost all of the affordable rental housing stock within the region. It provides most of the rent geared to income units, and it provides quality affordable housing for some of our most vulnerable residents and contributes to strong and vibrant neighborhoods across the region. As community housing providers come to the end of their mortgages and their operating agreements, the region needs new strategies and agreements in order to meet the goals of At Home in Durham and the Master Housing Strategy, and to ensure that these publicly funded assets are maintained in a good state of repair and continue to provide high quality housing over the long term. So the new legislative framework is something that will assist in this regard. What it is in July of 2020, the Ministry of Municipal Affairs and Housing introduced amendments to the Housing Services Act to provide this new streamlined framework for community housing to incent providers to stay in the system post the end of their mortgages and their operating agreements, and in order to enable that long-term sustainability of community housing. There was little detail provided in those changes to the Housing Services Act back in 2020. In July of last year, new regulations were released to operationalize the framework, and they included notably the ability for service managers like the Region of Durham to enter into new agreements under Part 7.1 of the Housing Services Act. So you're going to hear me talk about Part 7.1 agreements during this presentation. With housing providers that come to the end of their mortgages and end of operating agreements, as well as with other nonprofit housing providers that are not currently covered under the Housing Services Act. It also included new flexibilities to include under our legislated service level standards, alternate forms of municipally funded housing assistance, which will enable us to be able to be more flexible in meeting the needs of low-income people in our region. Additionally, housing providers can request to enter into exit agreements subject to plans for the continued operation of affordable housing, the redevelopment or reinvestment of the proceeds of a sale in affordable housing. Exit agreements do need to be made by mutual agreement, and it's anticipated that these would be rare. This new flexibility is critical to sustaining the valuable community assets that we have in Durham over the long term. So in order to understand this new legislative framework and its impact on our housing providers and the Region of Durham, it's important that we have some context as to how we got here. So I'm just going to give you a little bit of history. The province downloaded the funding responsibility and administrative responsibility or oversight of community housing to the Region of Durham in 2001. At the time of download, community housing providers that were built under legacy programs, federal legacy programs, were transferred to the region with their operating agreements intact. And the region assumed the responsibilities of the Canada Mortgage and Housing Corporation under those agreements. Federal funding continued to flow through the province to the region on a declining basis. The operating agreements of provincially funded community housing providers, however, were terminated and replaced by a legislative framework under the Social Housing Reform Act, and that in turn became the Housing Services Act in 2012. These former provincial reform providers, as they were called, now operate under Part 7 of the Housing Services Act, and we commonly refer to them as Part 7 providers, or projects. Both these Part 7 projects and federal projects are designated projects under the Housing Services Act, but they have significant distinctions as to when their original program obligations end and when the region no longer has a duty to pay subsidy. So specifically at the end of operating agreements, for federal providers, they're no longer required to provide affordable housing, and federal funding essentially ends. At the end of mortgage for the provincial providers, however, there's no end date in the Housing Services Act, and Part 7 projects must continue to operate under the Housing Services Act, and subsidy payments may be reduced as there's no longer a mortgage subsidy for the region to pay. These mortgage subsidy savings can be reinvested under new Part 7.1 agreements with the housing providers to better meet the goals of At Home in Durham and the Master Housing Strategy. It's important to note that as long as a project, either a federal project or a provincial project, remains a designated provider under the Housing Services Act, the region holds contingent liability for any provincial housing costs under the province's social housing agreement with the federal government, and this would include costs related to future financing. But providers that enter into Part 7.1 agreements with the region or exit agreements are no longer designated projects under the Housing Services Act, and the region does not automatically assume contingent liability for any future financing. So the Part 7.1 agreements allow the region of Durham to be able to negotiate what makes sense for the housing provider and the region of Durham over the long term. So by the end of 2031, all designated community housing providers in the region of Durham will reach the end of their mortgage or the end of their operating agreement. Currently, all federal providers are already at the end of their operating agreement, and by the end of 2023, 7 Part 7 projects, so those are those former provincial projects, will also be at the end of their mortgage. Housing services staff are currently working with the housing providers that are at the end of mortgage operating agreement, as well as those coming to the end of their mortgages at the end of 2023 about options under the new framework. We're looking at both meeting their individual needs, the individual provider needs, as well as ensuring that there's that strategic reinvestment of those mortgage subsidy savings to preserve affordable housing and to stay in the larger community housing sector. And the priorities under At Home in Durham and the Master Housing Strategy. So just a little something about service level standards. I had mentioned that there is greater flexibility to include other municipally funded benefits under the service level standards. Service level standards are set out in the Housing Services Act. Currently, the region of Durham must maintain 4,446 rent geared to income units. And rent geared to income units are specifically set out within the Housing Services Act. There are very prescriptive rules in terms of the calculations of those benefits and who's entitled to those benefits. Much of our service level standards are covered by our nonprofit and cooperative community housing providers. In fact, about 2,600 of those total units come from that nonprofit community housing sector. Under the new legislative framework, as I mentioned, the region can now include that additional municipally funded housing assistance. Currently, we do have the Durham Rent Supplement, very limited units within the Durham Rent Supplement that had previously been excluded from our legislative. Assistance that included under the housing or the service level standards are that they're not tied to the prescriptive provincial waitlist rules, and costs under these new programs can be lower for social assistance recipients, as there's the ability to leverage more of their social assistance payments towards their payment of rent, which reduces the subsidies that are paid by the region of Durham for individual tenants. The Regional Council has already approved flexibility to shift funding within the current funding envelope between all service level standard eligible units and financial benefits in order to be more responsive to local needs and maximize the number of housing units that we have available to us. And the new framework provides an opportunity to better meet these needs and to potentially increase the numbers of households that are provided housing assistance at the same costs. In addition to the added flexibilities under our service level standards, there is an opportunity to better meet the capital needs of our community housing providers. We had building condition assessments conducted in 2016 that revealed that community housing providers at that time will require more than $15 million annually to address all of their capital deficiencies identified across the collective portfolio. In contrast, annually, the capital reserve contributions amount to less than about $5 million. So this hasn't got better since 2016. The housing providers continue to struggle to be able to meet these capital needs. And the opportunities at the end of mortgage and entering into new Part 7.1 agreements with these housing providers provides an opportunity to address this deficiency by strategically investing in their capital needs through the investment of the mortgage subsidy savings under these Part 7.1 agreements. So what needs to be included in a Part 7.1 agreement? It does need to be it does need to have a minimum 10-year term and include a financial plan of at least 5 years that's been jointly developed by the Region of Durham and the housing provider. It's thought that the financial plan will be what drives most of the provisions under the Part 7.1 agreement. The agreement needs to address how the provider will meet its operating and capital expenditures. It will detail how market rents are set, and that's something that the Region of Durham and the provider would agree on. And it must set out a dispute resolution process with respect to compliance with the agreement. Additionally, it needs to have a plan for the continuation of rent geared to income or an alternate form of housing assistance for currently assistant households, as well as targets for both of those things. The region must provide funding to reduce or to defray the rent for targeted households and may provide additional funding as agreed to with the community housing provider. So we have a responsibility to pay for the subsidy of the rent geared to income or financial housing assistance, but there's also the ability to provide some operating dollars as well, or to assist with capital needs. So we're still working through the specific funding implications under Part 7.1 agreements, but generally the costs that are projected to be lower overall than they are under the current funding model under the Housing Services Act. Under the current funding model, the region continues to have a duty to pay subsidy to Part 7 providers, even at the end of their mortgage, although it will change a bit. So the funding formula under the Housing Services Act includes a subsidy for operating and mortgage costs, for property taxes, and for rent geared to income subsidy. At the end of mortgage costs will be zero, so that would reduce the mortgage component of the operating subsidy to zero as well, which would in turn reduce the region's annual funding commitment. In total, mortgage subsidies, the mortgage subsidy savings are going to be realized incrementally as mortgages come to an end. But in total, the mortgage subsidy savings are projected to be more than about $167 million by the time the last Part 7 housing project matures in 2031. However, the current funding model results in some housing providers having to cover RGI subsidy costs and does not address the underfunded capital needs of the sector or the sustainability of the sector as a whole. At end of mortgage, some providers may actually receive little or no subsidy at all. Under a Part 7.1 service agreement, however, the region is required at minimum to provide that full rent geared to income subsidy or alternate form of assistance. Although these costs are estimated to be higher than they are under the current funding formula, they will be more than adequately offset by the mortgage subsidy savings. It's important to understand that the funding implications of Part 7.1 agreements for individual providers varies, and a customized approach is required to ensure that providers can meet their operational and capital needs over the long term. So the new framework includes reinvestment of includes the ability to reinvest these mortgage subsidy savings under Part 7.1 agreements. And doing so will allow us to sustain community housing and address these underfunded capital needs, maintain and increase the number of assisted households under service level standards, and support new housing development and other priorities under At Home in Durham and the Master Housing Strategy within relatively the same funding envelope. The region's currently looking at opportunities. We're consulting with our housing providers and their boards, as I mentioned, to educate them about the implications of end of mortgage and operating agreements, and to speak to them about the options under the new legislative frameworks. We are planning individual and group sessions with our housing providers to help them to be ready to enter into these agreements as they come to their mortgages, and encouraging them to work with their sector organizations like the Ontario Nonprofit Housing Association and the Cooperative Housing Federation to assist them with this. We continue to work with other service managers and the sector organizations to develop tools and techniques to support the transition to new agreements and funding streams. And we work with other service managers as well on the Housing Strategic Steering Committee in terms of moving this work forward. It is an exciting time in the history of community housing in Durham and in Ontario right now. Community housing is vital to meeting the affordability needs of our low and moderate income residents in Durham and to creating strong and vibrant neighborhoods. The new legislative framework and Part 7.1 service agreements will allow the region to strategically reinvest mortgage subsidy savings at the end of mortgage to allow the region to meet its commitments to grow and sustain community housing and expand housing assistance in line with the goals and objectives of our long-term housing plan At Home in Durham and our master housing strategy. Thank you for your time.
Thank you very much, Roberta. I'm going to call on Mayor Foster.
Yeah, thank you, Roberta. Thank you for that. You lost me at slide 2. I'm not, and my colleagues and staff may hate the suggestion. A number of years ago, staff prepared a training session for councillors that outlined the different programs, existing programs, differences between them. At the end of it, I think it was then Mayor Ryan described it as a dog's breakfast. And the challenge that we have, at least that I have, is trying to piece all of these very divergent bits together to understand things such as what you've presented. I wonder, Madam Chair, if it might be helpful to poll members and perhaps more broadly across Durham Region to see if an education session would help. So this was 30,000 feet, and I got to tell you, I'm not even jumping past a hurdle yet on this.
You're going to be floored, but you're brilliant.
I've never heard that before. Would you say that again, please?
And honestly, to Chair Henry, I don't think it should be about polling our council members. I think it should be about educating our council members. I don't think it's an option.
So I was one step short of brilliant.
Just one step short. One step short of brilliant.
I will take that. Might I suggest as well, as you're talking about training for the housing providers, this may be an opportunity where you're already doing sessions to engage council. Do you have any focus, and Alan, we were just talking, any focus on developers? So there are so many developers that are, they're viewing affordable housing as a way of getting applications done more quickly. They, in many cases, seem to be quite ignorant both of the planning process, which is an odd comment to say, but as well as the programs. Are you looking at doing any training for developers?
Training with respect to the new legislative framework?
So I'm viewing the new ledge framework. Alan's nodding his head, which is good.
Yeah, I can take that question through the chair. What this change in the legislative framework does is it provides us the flexibility to not only provide those legacy programs and new partnerships with our existing housing providers, but as you saw from the slides, it frees up some of the funding that we've been pumping into the housing programs into redevelopment, as we spoke about our nonprofit housing corporation, as well as into programs like the at-home incentive program, where we work with developers to be able to provide affordable housing options. So where I see this leading is that we have our ongoing partnerships with our nonprofits, our co-ops through these service agreements. And as time progresses and we free up more money while at the same time sustaining that sector, that we can pump money into new development, which will include partners that we haven't partnered with before. And many of those could be private sector developers. So it'd be something where very similar to the at-home incentive program.
So I'll spin that a little bit. Are we engaging? Is there a format that we can engage the for-profit? Exactly what we were talking about earlier. If there's, a round hole, can we please show them what the round peg as opposed to the square pegs that frequently we see try to be smacked into these things?
Yeah, and through the chair with the at-home incentive program, what we found from the first year was some very experienced developers who were putting the round peg into the round hole, and they were most likely successful. And there was a number of developers who this is somewhat new to them, so they were putting their square peg into that round hole. So as we mature through this AHIP program and continue to provide capital to incent some non-traditional partners, we have the opportunity to educate them so that on the next round, they're able to put together a better proposal that will be more in line with what the goals of the region are as far as the development of affordable housing that's not only financially sustainable on its own, but for the region of Durham and its broader budget.
So I think that was a yes. I'm going to take that as a yes. Roberta, to roll back to the EOA and EOM, I know of one building in Clarington where they are. I have no idea how many years it has been since they have left the program. They ventured out on their own. The board and managers of that program are quite critical. They are delighted. You know exactly who I'm speaking of. The one slide suggested that there are incentives to try to keep these organizations within the fold. Is this problematic? And if I took the stories that I'm hearing without hearing the other side of the story, I would be led to believe that some of these groups are far more effective at delivering a better quality product with much less expense. So do we have a number of groups that are heading for the door as quick as they can head for the door? And if so, why and what are we doing about that?
So I wouldn't say that we have a number of groups that are heading for the door. I think
stampede. This is good.
I think that most of our community housing providers are as excited about the new legislative framework and the opportunities under Part 7.1 agreements as we are within housing services. The ability to kind of uncouple the programs from some of the restrictive rules, which have been the kinds of things that community housing providers have, struggled with for a number of years, and to be able to negotiate things that both work for the provider over the long term as well as the region in its plans and its strategies for the sector as a whole, they're much better under the Part 7.1 agreements than they are under the Housing Services Act. So I think people are eager to look at what can happen there and to build in those kinds of flexibilities and a customized approach. Regional Council had previously directed, prior to the changes in the legislation, that we look to delist some of those federal providers from the Housing Services Act because of the contingent liability issue that I had talked about. And there were a few providers that were taken out of the Housing Services Act before the province introduced a 3-year moratorium on it. Some of those providers have actually approached us to come back in under a 7.1 agreement.
Good information. Thank you. It's such an amazingly important file. Thank you, Madam Chair. Thank you.
Thank you. Mayor Carter.
So I have to echo what Mayor Foster said. It is very complex, and to find some simplicity to it, I think would be very beneficial, because I think both of us were sitting here going, "We like soup." Like, I mean, that's kind of thing. In your opinion, based upon the old agreement and this agreement, is this agreement, do you believe, more beneficial in regards to us accomplishing the task?
I think that the Part 7.1 agreements afford a great deal of flexibility to be able to meet the needs of housing providers, including those underfunded capital needs, as well as to address the kinds of things we want to accomplish within At Home in Durham and the Master Housing Strategy. The Part 7.1 agreements operate under the Housing Services Act. And so it's what's in the Housing Services Act that limits the kinds of things that we can do, from funding, operating, how tenants are selected, those kinds of things. But there's a great deal of flexibility. It's sort of a baseline, the kinds of things that I took you through in terms of it needs to be 10 years, there needs to be a financial plan, there have to be some targets. It doesn't specify what specifically that has to look like. That's something that the housing provider in the region of Durham would negotiate. So both partners would be satisfied with what's moving forward. So I'm confident that it will move us closer to the goals that we have in our plan.
So there's a couple of questions I want some clarity on. I mean, there's one of the blatant aspects of it is the capital needs of $15 million annually, a capital requirement. So under all the new agreements, I'm fairly familiar with Condominium Act, which states that condominium corporations must have a certain percentage that must be set aside in regards to capital repairs in their operating budget. So are all of our operators, do they have, or will they be mandated to be able to have 20 or 25% of the total budget allocated in regards to capital as part of a new agreement?
So under the new agreement, they have to have a 5-year plan that's revisited at the 5-year point within the 10-year agreement that sets out how they're going to meet their operating and their capital needs. So part of that would be their capital plan and what they put into their reserves.
So that would specifically state a percentage of what revenue is coming in, what percentage would be put off the side for capital repairs, and that would be over the next 5 years as part of the agreement that they would sign. Is that correct?
It would be part of the financial plan that will form part of the agreement, yes.
Was that not in place prior?
It was in place, but providers are funded under the funding model under the Housing Services Act, and the funding model under the Housing Services Act sometimes did unexpected things, and I think that was part of the issue. So the flexibility that we have under the new service agreements is to actually look at what's happening, how are they going to meet their operating needs. It's not a one-size-fits-all approach as it was within the Housing Services Act.
No, but it's pretty evident and quite clear that the capital requirements that are needed for our sites has been for a long period of time a challenge for the operators. Fair to say?
Yes.
Okay. And so it's blatant that the model needs to change, the operating agreement has to change. So do you have confidence based upon what's in front of us today that the components are there to be able to make the changes necessary so that we're not, 5 years or 10 years from now, we're sitting here saying, well, that number has increased in regards to capital repairs?
I think there's greater flexibility to be able to look at where individual providers are, because they're not all created equal. And some providers are going to need greater assistance from us in order to be able to meet those capital needs. And some are going to require lesser assistance from us in order to meet those capital needs.
And we'll have that authority?
There's a great deal of flexibility once they're removed from the Housing Services Act and they enter into a Part 7.1 agreement with the region of Durham. It's what we negotiate with that community housing partner.
Oh, so that's good news. Okay. Can I ask you about this 4,446? Who sets that number? That's what is provided of subsidies is 4,446?
That's the legislated service level standard under the Housing Services Act. So the province sets that number, and it would be the minimum number of under the current system rent geared to income units, but it can now include rent geared to income units or those alternative forms of municipally funded housing assistance units as well. We can include portable housing benefits under it as well.
When was the last time that number was updated?
At download in 2001. And
So why is that? It doesn't make any sense. This file has grown unbelievable over the last 20 years, and I've only been here 9 years, and that number has basically been the same number for 9 years. Our wait lists are longer. The demand on supportive units has grown tremendously, and the region has made some major commitments in regards to providing 1,000 new units, I think by next year. And so I'm wondering, why is this number? Who changes this number? Is this the province?
it would be the province if it was changed, but I don't think the province is going to change the number.
Why?
It's the minimum service level standard. There's nothing in the Housing Services Act or anything under the new legislative framework that would prohibit a service manager like the Region of Durham exceeding that service level standard. And in fact, Regional Council back in, I think it was 2004, did state that we can exceed it by 35 units. So we actually aim towards 4,481 because that was council direction. It's just the minimum number that the province sets. We shouldn't be going below that service level standard.
But don't you think it would be beneficial to see that number be increased into today's numbers? I'm not asking you a political question. I'm asking you in regards to operationally. Does that not make sense? I mean, I understand it's a minimum, but shouldn't our minimum? I know that I was under the impression that there was part of our whole collection is about 6,200 units. Maybe I'm wrong, Alan. I'm looking at you. Okay, good. Sure. But this minimum number, don't you think that if it hasn't been changed, and we're saying, let's say from 2005, don't you think this minimum number should be increased?
I think that there's certainly a need for more affordable housing and greater housing assistance for the low income people in Durham.
Smooth. That was very smooth.
Again, it's the minimum number, but there isn't anything that there isn't anything in the Housing Services Act that would prohibit the Region of Durham from exceeding that number.
No, I understand, we will exceed it, and I think we're committed to it. I just think that anyways.
If I may
Sure.
interject, when we're talking about the 4,446, and as Roberta stated, that's a provincial number. So when we complete our service manager annual information report, we report on that number. Each service manager is responsible for a housing and homelessness plan, which we all know ours is at home in Durham. And that's where we have the ability to set targets, and we have one of our goals, affordable rent for everyone. So according to our housing plan, we've already set that target higher, but we don't want to go back to the province to have them impose a made-up number on us or any other service manager, strictly for reporting purposes. So there has been that shift, not only to more flexibility, but as we keep reminding the province, we all have our own housing and homelessness plans, and that guides the work that we do, as opposed to the province, which doesn't pay for anything.
My last question, and thank you very much, Director, and greatly appreciate that. My last question is based upon this 7.1 agreement. I don't know if I'm using the right words or terminology. Do you believe that we'll have better outcomes based upon what is available now in regards to redevelopment, divestiture, new investment, utilizing dollars better, creating safer, healthier environments for people to live in Durham Region based upon our responsibility as the regional government?
I think that all of those things are things that we want to be speaking with the housing providers about and ensuring that whatever we put into these 7.1 agreements is going to move us in that direction towards those better outcomes.
But does it give us more authority over those individuals once they sign those agreements, that the region has more authority over them?
What do you mean by more authority?
Well, I look at accountability because I know that some of the prime example is, I mean, we've talked about the capital aspects. Um, one of the aspects is in some circumstances, we have volunteer boards, and those volunteer boards may not have the expertise that our staff have. And when it comes to capital, having someone that is an expert in regards to infrastructure and things that are necessary to be done, it would be beneficial if the region had more of a voice at the table to make sure that the pressing needs were being addressed. Many of the volunteer boards struggle with the expertise that is necessary to be able to make um, the proper decisions at the proper time. So I'm wondering, under these new agreements that they sign with the region, would the region have more authority over them or more oversight over them so that we may be able to accomplish more?
I think one of the things that we are looking at when we are looking at Part 7.1 agreements is the readiness of the provider. And you are correct that some providers will require less oversight than other providers. And that would be something we would negotiate within the agreement. A lot of those providers that you're saying that might be struggling are actually coming to the region and are wanting the support of the region. So, and not just financially, but in terms of assistance with governance. So we do work with those sector organizations and with the individual providers now, and we will continue to do so on a under a Part 7.1 agreement as well.
I think I'm even more confused, but I appreciate the effort. So thank you very much, Madam Chair. Thank you.
Thank you, Mayor Carter. Councillor Brenner.
Thank you very much, Madam Chair, and through you to our presenter, and thank you so much for the enlightening information. Having worked in the social housing field for well over 40 years, I do have a couple of questions as it relates to some of the things that you touched on. When you refer to the federal component, I think the federal funding, did that include, for example, there was a program federally that was, oh God, even predates me, that really predates, the limited dividend programs which were provided to private landlords that enabled lower rents to be applied for units in buildings that where the landlord or the owner of the building had put in applications. Are you familiar with the limited dividend program? And I'm going to assume, if any exists, it would probably be in the city of Oshawa, based on the age of Oshawa versus the other municipalities.
I am familiar with the program that you're speaking of, and I believe we didn't have any limited dividend programs downloaded to us at all.
Do we know if there's any existing limited dividends that remain anywhere in Durham region?
There were no limited dividend programs in Durham region.
Thank you. The second question that I have, and Mayor Carter touched on it, and that has to do with, I guess, the new agreements and also the whole issue of governance. And you're correct. Some boards are better equipped than other boards to be able to deal with governance models and some of the day-to-day challenges and also long-term challenges. Now, I know that historically the various co-op federations used to have training for new boards. I know that there used to be training through ONFA for nonprofit boards. Do you see in those agreements the ability for Durham Region to play a role in terms of ensuring that there is proper training that is available to the boards, because they do change? And I mean, I see some within the city of Pickering that are frequent flyers in terms of complaints that go back to the region in terms of concerns about the different tenants or members of co-ops, raised as an example. Are we looking at incorporating a requirement for training of all new or change boards that are part of our agreements? And if not, can we?
There's certainly potential to include that within an agreement. Currently, because as I stated, they're coming to end of mortgage between now and 2031. So currently, we are actively working with housing providers and their boards, and the sector organizations, which do continue to offer governance training as well as property management training, all sorts of different types of training. They've also stepped up and are offering assistance in terms of negotiating these Part 7.1 agreements as well. Those sector organizations are. But the Region of Durham, the Housing Services Division, is continuing to work with all of the providers over the years to make sure that they're ready to enter into these 7.1 agreements so that they have the governance that's there. But there is the potential to, address issues like training, like succession planning, those sorts of things within the agreement.
So do I take that as something that you're able to do, or something that requires direction to do?
That's something that we are able to do within the agreement.
Would it be possible to update Health and Social Services as we move forward in terms of monitoring how the training program is going?
Yes.
Yes, through the chair, I was just going to mention that we do report annually on the status of At Home, so we can provide an update with the number of housing providers that have transitioned over into a Part 7.1 agreement. With respect to, I think, the nuances of the individual agreements, I think it would be more beneficial to bring to council any of those issues that are outside of the norm, right? The exception basis, because all of our agreements will be looking at the training element, succession planning, as Roberta had mentioned. We can make sure that those co-ops that aren't currently members of CHF, that's included in their financial plan to make sure that they maintain their membership so they have access to all of that material and training, and continue to work with them. I think it's a much better use of our time to share with you the progress of this transition to Part 7.1, and as I said, on an exception basis when something does occur. I should also note that you may sometimes get calls from constituents who live in a nonprofit or a co-op telling you situations that have occurred, which may not always be the most accurate representation of what has actually occurred. So where you may think that there's a lack of training or a lack of knowledge from a board or property management, there's usually more behind the story than you're being told.
Thank you. Also, and I guess you had also responded, I think it was to Mayor Carter, in terms of the provincial target, and which was set back in 2001, and then also the motion, the direction from council, which I think you said was 2004, which exceeded by what percent?
It exceeded it by 35 units.
And we go in excess of that, am I correct? I'm referencing that because it's like deja vu, because I recall moving that motion back in Health and Social Services back then as well. And I'm not surprised that the provincial government, and it crosses all provincial lines, they have always only looked at the minimal requirements and have never set higher standards. But I'm really pleased with the fact that Durham Region has always exceeded those provincial minimal standards. And I'm comfortable with the fact that with the leadership that we have at Durham Region in terms of our housing sector, that we'll continue to do that. And I thank you for that.
Thank you, Councillor Brenner. Is there any further questions from anybody online? Seeing none. Roberta, thank you very much for the presentation and for the sharing of the information, and Alan for participating in updating as well too. We do look forward as we're moving forward as to these changes, and okay, please go ahead.
Sorry to interrupt. I just wanted
okay.
to mention before Roberta leaves that she is known as, she is sought after as a technical expert on social housing, the legislation, as well as the operations of community housing. So she's sought after by not only service managers across Ontario, but by both ONFA and CHF. And she was also instrumental in moving us towards the vacancy-driven waitlist, which we are extremely proud of. So I just wanted to mention that.
And thank you for sharing that, and well done to you as well. We look forward to the further updates as we move along, but also to the education piece. Thank you. And next is our illustrious Dr. Kyle and the COVID-19 and flu update.
Oh, there we go. Good morning, Chair and committee members. Happy to be here to provide an update on COVID-19 and flu. And I'm the third presenter, and I'm mindful of your time, so I'm going to race through my deck and try and focus mainly on what is new since my last update. First, it's important to note that in March, the World Health Organization issued a statement which brought attention to changes to its working definition and tracking system. I won't go into the details, but I think it's important to note that to date, Omicron represents the most divergent variant of concern, and Omicron viruses account for over 98% of the publicly available sequences since February. So the pandemic continues in Durham Region. If you look at this graph and the right-hand side, you'll see that it's continuing its slow burn. We are seeing and continue to see outbreaks mainly in hospitals and long-term care homes. Fortunately, the trend is downward, and in terms of severe outcomes, mainly hospitalizations and deaths, they continue to be low. We continue to roll out vaccine. We're getting close to 1.7 million doses administered. The main channels are pharmacies and our community clinics. And as you can see in the graph, most of the vaccines since the new year has been the bivalent. When I say new, probably the fall. If you look at vaccination coverage, if I can draw your attention to the tile at the lower right hand, you'll see that only under 17% have received any vaccine dose within the past 6 months. So we have some work to do in that regard. This is the first major change. So as of April 1st, the number of sampling sites for our wastewater signal has been reduced from 7 to 2. And this is by direction of the Ministry of Environment, Conservation and Parks, which is responsible for the management and funding of Ontario's wastewater surveillance initiative. And if you look at the signal in the graph on the lower right hand, you can see that the trend in terms of the signal is downward. There have been no changes with respect to guidance for case and contacts. I should note that there has been an easing of some of the pandemic response measures in long-term care homes and retirement homes since the end of March. Flu continues to smolder along. Not many cases. We haven't seen a predominant second wave, if you will, which typically this time of year is due to flu B. You can see that as of this week, our flu status is moderate. And as you can see, in terms of respiratory outbreaks, since we started tracking the end of August, there have been just over 200 respiratory outbreaks, and the causes are noted in the graph at the bottom. And there hasn't been any significance in terms of childcare and school absenteeism, and there have been no changes to the current masking requirements. In terms of eligibility for COVID-19 vaccine, we're expecting an announcement later this morning. And that announcement, among other things, will let us know who is eligible for a spring booster dose and what is the dosage interval. Until we see the details, of course, we're in the dark like you folks are. We have some sense of what it's likely to be, and it's important to note that we need a bit of lead time, and we've had no lead time in terms of amplifying the message locally and getting the machinery in place for us to roll out vaccine at our clinics. And speaking of clinics, in terms of the vaccine delivery channels for both COVID-19 and flu vaccines, there really have been no changes since my last update. So that's it, Chair. Quick summary of where we're at. Happy to answer any questions that you or the committee may have.
Thank you, Dr. Kyle. I do have Councillor Brenner.
Thank you very much, Madam Chair. Dr. Kyle, thank you. This is sort of a quantum leap, but it is flu-based, so I checked to make sure that this question would be appropriate since it's flu was part of your presentation. You probably know where I'm heading, and that's a question regarding the avian bird flu situation in our region. And first off, I want to thank you and your staff for getting the information out as quickly as you did when I reached out a couple of weeks ago. Would you be able to provide an update regarding what it looks like across the region? I know that a lot of cases are not yet confirmed, I'm assuming, but I know that there's been an excessive number of birds that have been picked up in every municipality. And then from time to time, we'll hear something on the news, like we heard the unfortunate situation with a dog in Oshawa, I believe it was.
So thanks for the question. I'm putting her on the spot, but our medical lead on avian influenza is Dr. McTavish, who's an associate MOH, and she has been working closely with the Director of Emergency Management and with some of the affected local area municipalities regarding this issue. So, Chair, if I could defer that question to Dr. McTavish.
Wrong one. There. Thanks very much for the question. So it's an ongoing issue for sure in Ontario. It's not a new issue though. Definitely. We've heard a bit more about it recently because there have been more birds found. So people are letting their councillors know, municipalities know. But the risk to human health is tremendously low. The dog was interesting for sure because that's the first case I understand globally. So there's a lot of attention about that. So we've been speaking with our provincial peers about that. But it's not really new because scavengers are known, when they eat carcasses. So wild dogs have been known. We've heard about skunks and raccoons in other parts of Canada. So the dog was acting like a scavenger. So that's sort of how the pet got it. The risk to human health is so tremendously low. It's an avian influenza. So globally we hear of cases, but it's usually people who have backyard poultry. The poultry is sick. They're caring for them because it's their livelihood. So we do get reports. Whenever there's federal reports, we get them. But there has not been a case of avian influenza. I think the only case in Canada was in the early 2000s, and that's from somebody who came back from travel to China. So we deal with the human piece. So emergency management has been really great about dealing with the municipalities about sort of the emergency response piece. What do you do with the dead birds? So we put out as much information as we can. We continue to work with James in the emergency management office, but if people are finding birds, the municipalities are taking care of them. Thank you so much for all your work with that. People know what to do with them when they find them on their property. They bury them based on bylaws, and we'll continue to monitor. And if there is any risk increase to human health, you will all be the first to know. So I'm happy to answer any questions, but that's sort of the summary now.
Thank you. The summary's been excellent. I've never doubted the side of it as it pertains to human risk in terms of that it's very rare, if any. I've got to be honest, I looked at it through the lens of being a pet owner and a dog lover and cat lover, and I know that that's not the area probably that public health would be involved in, but I do appreciate the information that you have shared with the lower municipalities, and in particular, even the whole question of bird feeders at this time of the year. You did a great job. It was very positive in terms of the messaging through our municipality and getting that information out. And I can tell you it served a real powerful message to my partner when she had to take those damn bird feeders out from the backyard for the first time in several years. So I thank you for that.
Thank you, Councillor Brenner. Any further questions? Thank you, Dr. Kyle. Moving along in the agenda, we have no delegations under health. There's no correspondence or reports, but is there any questions to health? Seeing none, moving on to social services, we have one report on 8.2. Mover is Mayor Foster, seconder, Councillor Anderson. Any questions? Mayor Foster, can you hit your button? There you go.
So, Madam Commissioner, I hope you take these comments as intended. Some of them are somewhat pointed. I found that the report attempted to spoon feed us at the same time as fork off into a variety of directions. And, while I'm aware of why we have this, it let me somewhat flat. So thank you.
Any further questions? All in favor? And that's carried. Keep your day job. We have going under to other business. I believe that Chair Henry, you have a motion.
Thank you, Chair. Just a preamble, but to the motion, I apologize because we didn't finish this till after 9 o'clock this morning. So thank you. And I'll need a seconder. So I'll give you a motion to alter the rules to introduce a motion related to the crisis of homelessness, opiates, and mental health.
Seconded by Mayor Foster. Please go ahead. Oh, all in favor?
Okay, thank you. And I haven't even had a chance to ask members of council for a seconder, so I hope that I get support. So if you allow me, I'll read it, and then I'll look for a seconder, and then I'd like to speak to it.
Please go ahead.
Whereas there's a need for a partnership with the upper levels of government to address the growing homelessness, mental health, and opiates and other addiction crises impacting Durham Region and municipalities across Canada. Now therefore be resolved that the staff be directed to develop an engagement plan that encourages the federal government to declare these crises a national emergency and to work with the provinces to ensure that the proper actions are taken to appropriately address the emergency, and that staff be directed to report back on the engagement plan and next steps at the next Social Services Committee meeting, Health and Social Services Committee meeting. And if I can get a seconder, I'd like to speak to it.
Councillor Brenner, please go ahead.
Madam Chair, as you're watching in the news across this country, there are events happening that are not the results of municipal government, but yet municipal government is the reactionary service agent for the challenges that we're having. But we don't have the tools to correct it. We're not mental health experts. We do not have the ability to change the judicial system. And most of all, there needs to be the questions need to be asked. And it just cannot be at our municipality. These problems are coast to coast. There needs to be a declaration of this crisis, and the federal government needs to take the lead and ask the questions. How did we get to where we are today, and where did we fail? If this is happening in every community across the country, then there is a problem. It's not a Durham problem, it's a Canadian problem. Madam Chair, the challenge is while we're doing great things in our community, it's also being paid for the most part off the backs of our residential homeowners and our taxpayers, as it is in every other municipality, large municipality that's having this problem, including our conversation yesterday related to the town of Whitby. That this is beyond our ability to fix, and it needs national leadership to address the issue, to come out with a plan, and make the changes where we need to make that. But the only way we're going to make those changes is to say, how did we get here? In Durham Region, we're blessed right now. We have an unemployment rate that is considered zero, yet we have more and more people living on the streets. We have challenges in not just the city of Oshawa, but Ajax, Pickering, Whitby, and some of our northern municipalities with the challenges that we cannot fix, but we are supporting with taxpayer dollars. This is no longer within our realm or the affordability of municipal governments to continue to do this without the support of the federal government. And I hope that staff can come back and deliver the information that's needed. I would have liked just to put a motion on the floor to have the federal government declare this a crisis, but they're just going to take that and do what they do with most of the stuff we do. But we need to get our partners across this country organized. We need to now stand up for those who need help, but the federal government has to take the lead. You cannot have 440 municipalities in Ontario working through 444, sorry if you count them all, trying to work through AMO or the big city mayors or Marco or the chairs and mayors of the region. We're not being heard. We need to organize across this country, deliver a message to the federal government that says, help us, because we can no longer do what needs to be done on the scale that needs to be done, because every time we do something better, the problem gets bigger. And I don't understand how the problem continues to grow when there are opportunities. So where is that problem? Are we not getting people through the educational system? Are we not investing enough money into colleges? Are we not putting enough money into training or counseling at the front of this? But we can't answer those questions. And I believe the federal government has an obligation to the people of this country to deal on a national issue. Mayor Carter has heard me say this a number of times. In a very difficult part of Canadian history, with very little technology, just after Confederation, we built a railroad connecting this coast to coast through mountains and valleys, and the work was unbelievable and based on a time of very limited technology. Well, this is 2023. Data is collected. We have the information here. There now needs to be a plan, but not just a regional plan. And the millions, tens of millions, and the hundreds of millions of dollars being spent on this issue in this country, there needs to be a focus, there needs to be a direction, and then we need to call it what it is, and that is a crisis. And the federal government needs to, once they declare it a crisis, they can put the tools and monies in place to make it happen. If we call this a crisis in Durham Region, and it is, the municipal taxpayer is on the hook because we've called it the crisis. But if you have a problem in every major city in this country, and they're all having the same problems, then it's a national crisis. It's not a local crisis. And I hope members of committee will help. I hope staff comes back with the direction to the next committee meeting so we can have a fulsome discussion here at the committee. And then that committee gives the recommendation that we take it forward to our council. And then we direct it to where it needs to go. AMO, FCM, big city mayors, mayors and regional chairs, our rural mayors, all of those organizations who are all talking about it. But there needs to be a focused plan in their direction. So thank you for allowing me to bring the issue forward, and I apologize to committee because I didn't get it to you in advance.
No, it's fine, and thank you, Chair Henry, for bringing this forward. I think that a lot of what we need to get focus on is that's the education side of it, but the reality check. There's a lot of ignorance out there. Even just the experience of yesterday, we're talking about Whitby, and there's a lot of ignorance out there as to what is happening out in our communities and what we need to be doing. I'm going to call upon Mayor Foster.
Thank you, Madam Chair, and Mr. Chair, to yourself, the mover, and the seconder. Two suggestions. I'll reflect on part of the conversation at Works yesterday. And I believe it was Councillor Crawford who indicated that she actually got a response from it was either the provincial or federal government. It was astounding that she got a response. And then your point to how long that response took. So I wonder if it would be appropriate for staff to take as direction, reporting back on what we hear from who and from when, as a reality check and an accountability check, because you're correct. Municipalities across Canada make requests, make suggestions, and on a routine basis, those requests are unanswered and completely ignored. And I wonder if, as we move forward, and Mr. Chair, this would be directed at you, if we start requesting responses within a certain timeline to articulate that if our level of service is blank, that we expect both the province and the federal government that we would appreciate a response within 120 days. Well, I have no idea what's appropriate, but I wonder if in this motion and perhaps others moving forward, that would be a reasonable addition. And I'll leave that with you as a suggestion.
Thank you. Mayor Carter.
First of all, Mr. Chairman, thank you very much for bringing the motion forward. I greatly appreciate it. I'd like to try and make sure that all members get a copy of the motion so we have a better understanding. Some may have a great deal of confidence in AMO and FCM. I don't. We've been working hard with both those organizations to be able to bring this to the light of the federal and provincial government. Yeah, Mr. Chairman, you're aware that the big City Mayor's Caucus has requested a meeting with the province for over a year now, an emergency meeting, by the way, in regards to this issue. And still, there is no formal date, to my understanding, about when that's going to happen. And the letters that are being written on behalf of AMO and FCM seem to be just being filed. You're absolutely correct. This is a national health crisis, in my opinion. I think we've been speaking about it as a national health crisis. Mr. Chair, I support you 100%, and I appreciate your leadership on it. But I also think that we have to request a face-to-face meeting with the Prime Minister and the Minister of Health, and not as part of a some kind of thing with FCM or AMO. I think that the region, you as our chairman, need to have a face-to-face meeting. And I'll put it in these words: a come to Jesus talk with the Prime Minister in the best diplomatic way you can, just to be able to say that this has got to stop. The federal government has to be engaged full way. The Prime Minister was in town just the other day, which I wasn't aware of until I saw it on social media this morning. It's just too bad that the Prime Minister doesn't understand the seriousness of it. I'll be very honest with you. I'm encouraged, and I shared this with both our Commissioner of Social Services and our Chief Medical Officer of my conversation with Minister Tavolo yesterday, and a request that he's made of my office. I'm encouraged by that. But I think the federal government we have to get in front of their face. We have to be standing in the Prime Minister's office, stating that this no longer can be ignored. And I don't know if, Mr. Chairman, I don't know if you're comfortable with that, but I'm wondering if you would take it under consideration.
He's got him on speed dial.
Absolutely. I was aware yesterday, but not invited. I believe the mayor of Whitby was not aware until maybe I made you aware.
Until you made me aware.
And wasn't invited. And often you would think that when a leader comes to a community, they would at least allow 5 minutes with the mayor, maybe not the chair, but the mayor of that community. The goal here is that, Mayor Carter, you're absolutely right. I'm tired of just hitting the wall with this issue. It's my goal that through this motion and staff's ultimate report that we can unite the senior leadership of communities across this country to raise it as a national issue. I would take the opportunity to bring a number of mayors to Ottawa if we could get that meeting. But I have been this is my second term as regional chair, and I can tell you I have not had a meeting with the Prime Minister representing a community that keeps the lights on for a third of Ontario. I have met with the Premier, but not the Prime Minister, and that's upsetting. Their solutions are not solutions, and quite frankly, I'm thankful that the money that they give us, but that's not the answer, because the money that we're investing is only solving the problem of that moment. You don't fix the problem until you talk about the root cause. And again, we're seeing challenges, and we're a caring community. The region is amazing. We have so many good people doing so much good work, but people flow to areas where that good work is taking place. And the challenge is that if it's an issue, then it should be dealt with in the community where it's an issue, and having all of those communities having the supports within their communities to make this a less of a burden on other communities. I would be called tomorrow. I'll write him, but I can tell you that I doubt very much that he will listen to us. It is going to take a bigger voice. It's going to take a national voice to talk about the sustainability of where we're going. Financially, the monies being spent collectively across this country would be in the tens, if not hundreds of millions of dollars. And those monies could be spent on other things. Things that the public expects from their expects from our level of government: roads, infrastructure, healthcare, all of the stuff that we do really, really well. We don't do homelessness. We don't do opiates and addiction challenges, and we don't do mental health. Yet we're trying to turn our staff into experts in fields that they don't work in. It's mind-boggling. So there needs to be that national meeting where people sit down and take this challenge seriously, and we come up with the who, what, why, when, where, and how, and make it all work so we can get on with helping people. So I apologize for the rant, but I do this all the time, and I'm thankful to my colleagues listening to me. But like any other senior leader in any other organization, we're not being heard. And the only way that we're going to be heard is if we do it collectively as a voice. And there's going to be an election in not too distant future federally, and this needs to be made a national issue. And maybe we can start that right here in the region of Durham.
Mr. Chair, just to let you know through Madam Chair, whatever data you need from Oshawa, we'll make it available to you. So whatever, if your staff reach out, and we can make sure that collective data that we have can be shared with you. I think that's number one, that you need to know that. I also would encourage our communications departments, and I'd encourage all mayors, by the way, if we have data to make sure the chairman has that information. The second component is, I think that we have to look at some kind of an immediate campaign in regards to what we are facing, not only as the region of Durham and the area, but the urgency of having the federal partners and provincial partners at the table, I think, is absolutely necessary at the same time. So I just, I don't know what the answer is, but I worry, Mr. Chairman and Madam Chair. You're probably well aware of Tranq, the new drug that they're mixing with fentanyl. To my understanding, naloxone does not reverse the effects of the combination of Tranq and fentanyl. I think there was an emergency. I think it was in Toronto that they came across the situation where they had 4 major overdose that were this combination. And just for description basis, and I think might be a little grotesque, but I think it's important the public hears. This particular drug, when it's mixed with fentanyl, eats your flesh. And it's so painful that people continue to inject it because of the reason that they're trying to look for pain relief. And the seriousness of this drug is just horrific. So, I think we're well past a moment of crisis, to be honest. I think it's a national issue. It has to be. I was in Toronto on Monday. I was shocked at not only the severity of the addiction issues that I saw in the richest streets in Canada. I was on Bay Street, and the severity of individuals that are completely just broken due to both mental illness and drug addiction is just extraordinary. And I appreciate what the chairman's doing. So whatever help you need, you've got it from us in Oshawa, and we thank you very much for your leadership on it. And thank you, Madam Chair.
Thank you, Mayor Foster. I'm Mayor Foster, Mayor Carter. I don't know why I do that to the two of you. It's like my own kids.
You may be offended, but I thank you.
I also want to thank the chair for bringing this forward. And I'm just curious for all of us as mayors who've had meetings with our MPs or conversations with our MPs or even yourself, Chair, how much has this actually been a conversation?
My circumstance, all
Okay.
Madam Chair, just to let you know, on Monday, I was the keynote speaker for the National Day of Prayer, and we had 44 MPs and MPPs in the audience of 500 that were many of the leaders in the GTA. We were in downtown Toronto, and every opportunity that I had to be able to connect from all four parties, by the way, and the leaders of the four parties, I had the opportunity to be able to say that. And for the first time, and I'm just saying this, for the first time, Finance Minister Bethan Foley sat beside me and said, "Oh my God." And I think that was the first time that it really kind of, him and Minister Tabola, I think it's the first time that they went, wow, this is something that I think can't be ignored. And the outreach from those 44 MPPs and MPs have been extraordinary through my office in the last 48 hours. I'm encouraged by that. Now what happens about them being fully engaged?
So I'm going to tell you that my meeting yesterday afternoon actually with Peter was he did speak about your speech and he was floored, and because we raised also the issue about homelessness and not just within Whitby but across, and just sharing with him, and he had taken to heart especially what you had said, so that was noted very much with him. I know that for myself personally with my MP, we talk about housing, but the conversation has not yet taken place fully about the homelessness, and the situation that we're experiencing is right across from his office. So I'm hoping that this helps to push that envelope forward a lot more, because I think that even by the end of the month, as soon as we close our warming shelter, it's going to be more present within the community. And I tell you, the phone calls that we're getting and the concern that we're getting, a lot of it is about we need to push it out of our town, because Whitby doesn't have homelessness. Not until we started bringing services into our community has been some of the excuse, which is unacceptable. But I'm going to move for a vote. Mayor Foster. You have to push the button.
I
Now
push
you
the
can
button,
talk.
so you can push the button. So as an observation, and municipalities have typically not done this, there will be a federal by-election in the not too distant future. Typically, and I will again put it out there as a thought. Typically, lower level governments do not want to be seen as interfering. However, there is an opportunity to raise across all candidates. There's going to be no incumbent in this, to raise issues, to raise public awareness, and to look for commitments as provided by the individual candidates. I think we have an opportunity to highlight the challenges. A lot of the population in Clarington, if they're not going to downtown Oshawa, do not understand the issues. We are getting a taste of it. It's coming our way, whether we like it or not. But again, I will leave it up to perhaps brighter and more cautious minds, or not, to consider how we can use a federal election to promote the causes of our communities. And we typically haven't done that federally or provincially. We're not getting very far, and typically haven't in the traditional forms of moving agendas forward. Maybe it's time that we become more active and more outspoken.
I agree. Any further? All in favor? And that's carried. Thank you very much. Next meeting is May 4th. Mayor Foster.
Just very briefly, I wonder if IT would look at the link to the update. It doesn't work. I think it was just Dr. Kyle's information, but prior to council, other councillors may want to know that they've got everything.
Okay, thank you. Next meeting's May 4th at 9:30, and need a motion for adjournment. Councillor Anderson, Mayor Carter. All in favor? Thanks.